Hi, this is Late Wire here. Happy Saturday. Just like to address a couple of issues that came up in response to the original video. First of all, thank you so much for all your feedback. I really appreciate it. It's not really easy to do these types of things, and it's good to have some idea of what I'm doing right and wrong, so that way I can better direct it in the future. So I got a couple of responses, and definitely a lot of valid points. The first one is from Jason Gilliland. We had kind of a little bit of back and forth on the original YouTube comments page. It said that, the culmination, I believe, of the conversation was by Jason. He said, I agree that third-party payer is a bad idea because it completely separates expenditures from individual value scales. My point is that high percentage of GDP on medical spending is not a bad thing in and of itself, but only in so much as it is due to third-party payer systems. I also totally agree that in a free market system, costs would be lower. Look at LASIK eye surgery and breast augmentation. They keep getting cheaper. Quality improves because insurance does not pay for them. Well, essentially, we agree. Unfortunately, in the video, I used GDP as a measure of whether or not we have an efficient system, even per capita GDP. And of course, that's incorrect, as Jason rightly points out here. The reason it is incorrect is just as Jason points out, actually, is that it could be that if we had a totally free market in medical care, maybe the per capita GDP would be more. Maybe it would be not 25% less or 30% less or 50% less. Maybe it'd only be 10% or something like that. Maybe we would spend almost as much under a free market system as we currently do. However, the reason why most economists, or rather I should say many economists, I believe this is a significant, if not the most important problem, is just because of the incentive structure it sets up. Because of that situation, it is going to end up being the number one factor, because also it could presumably push down the other factors. Like, for instance, if there were taxes and things on medical care, if the public had to pay those directly and they were seeing the bill for them, there would be downward pressure on that. So I'm just going to read to you one little passage from, it's from a Cato paper on healthcare. It's talking about a study that the RAND Institute did. It's talking about third-party payer here. So it says, the RAND Health Insurance Experiment, which is the largest study ever done of consumer health spending and consumer health purchasing behavior, provides ample evidence that consumers can make informed cost-value decisions about their health care. Under the experiment, insurance deductibles were varied from $0 to $1,000. Those with no out-of-pocket costs consumed substantially more health care than those who had to share the cost of care. Yet, with few exceptions, the effect on outcomes was minimal. So, I don't agree with trying to chart healthcare expenditures to healthcare outcomes. There's a lot of conflating variables in that. However, the evidence here presented by the RAND Institute was very well done, and it basically points directly to what kind of we were saying all along, is that basically people kind of use this all you can spend healthcare buffet, when they've already paid the down payment through their employer. So, I mean, I could go into that a little bit more, but I'll leave you to read the Cato paper because they articulate it a lot better than I do. There's also other studies that look into just how much different organizations overpay. I responded on Reddit. I mentioned that as a physician myself, I send patients out to get their labs done occasionally, to check cholesterol, check electrolytes and things like that, just regular screening type things. And I had no idea what the lab was charging. And neither did any of my patients. They just they got the lab slip, and our printer and our computer system says to go to this one lab or to go to the hospital, which I happen to work for. Depending on their insurance, it says to one or the other. And they were charging 50 to 70% more than this other organization, which, by the way, also took insurance and everything. The other organization was just better run. And one would think, hey, if you're charging 50 to 70% less, and you're providing the same level of service, same quality, so it's a far better run company, clearly. But why isn't it winning over these other organizations? And the answer is third-party payer. People just don't care. They want to get their labs done. They get it basically for free, and so they go to these other two labs, including the hospital lab, which is just absolutely exorbitant. So that's just one example. Now I choose to send my patients to this lab that charges less, even though it wouldn't affect anything for my patients or myself. Their premiums aren't going to go down. They're not going to pay less. I'm not getting paid by this other place. They didn't even buy me lunch, which, they could if they wanted to. I don't know if, well, I'm not going to say your name, but really I'm not getting anything, and I'm just trying to do it to be part of the solution as opposed to part of the problem. I think that better organizations should prosper, and this third-party payer system fights against that, which is the natural inclination of the market.